last year, certainly the flu season was much milder than what we've seen in the past. And flu season is always up and down. I mean, some years you have a bad flu season, like we had a couple of years ago, and some years you have a really light flu season. Last year, I think with COVID being a little bit more prevalent, you had something called viral interference, and it's also why we saw a late onset of RSV this past year too, because when you have one virus that's really, really, really prevalent, then you have other viruses that can't compete with that at a high level. And so when we saw COVID being really, really high, flu and RSV were a little bit lower. And I think probably masks and social distancing and all that had some to do with that as well. You have COVID, which is really, really, really infectious, versus flu, which is comparatively far less infectious. Doing those measures of masking and social distancing are really going to cut down on your flu cases as well. Certainly, I would recommend for people to get their flu shots this year, as with any other year, because as we know, if you happen to get flu and COVID at the same time, that's certainly more of a recipe for disaster. But just urging people to get their flu shots to keep themselves safe in this time where we have a lot going on.
Mm-hmm.